I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long week while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. I hope and pray that they will. But today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm gonna live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be a law. How I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill.
He signed your bill. Now you're a law.
Oh, yes.
All right, we can go ahead and get started. So again, welcome to the webinar around pesticide policy and public well-being, navigating the legislative session. Thank you so much for joining us today. My name is Anna Gray Anderson, and I am the Community Engagement Coordinator for People and Pollinators Action Network. We've really got a great presentation prepared for you, but first we just wanted to tell you a little bit about us. So for those who don't know, we are People and Pollinators Action Network, or PPAN, the host of this webinar. We focus a lot on making Colorado a safe haven for all who live here, from people to pollinators. We do this through grassroots advocacy, education, and outreach, kind of like this webinar. We also do a lot of policy work that you'll learn about today. And then we also make Colorado a safe haven through community mobilization and habitat creation. For example, our Habitat Fund goes towards creating pollinator safe spaces while promoting community mobilization. So now we will just get on to the webinar. So we are really happy to have two experts with us to speak on pesticide policy and public well-being. First, Bret Turner, who currently resides in Denver, Colorado, and is originally from a small town called Brookville in Southwest Ohio. Bret is a member of the board of People and Pollinators Action Network and works full-time at the University of Colorado Anschutz Medical Campus as a Hazardous Materials Specialist in the Environmental Health and Safety Department. Bret graduated in 2015 with a Bachelor of Science degree in Environmental Resource Management from Penn State University, and recently in 2023 graduated with a Master of Public Health degree with a focus on environmental and occupational health. He is passionate about the intersection between human health and wellness and environmental science and conservation, And in his spare time, he loves to spend time in nature, searching for native plants and birds. And today, Bret will be presenting his thesis to us called Minding the Gap, a comparative policy analysis of pesticide regulation in Colorado and the United States, where he'll explore the gaps in Colorado's pesticide regulations through the public health and health equity lenses. He'll draw comparisons and make counterpoints to other states, and will recommend exploratory paths for the future of pesticide regulation in Colorado. Next, we are lucky to have Melissa Ordelheide with us as well. Melissa joined the Siegel-Long Public Affairs team in 2021. And prior to the Siegel-Long team, she, with a keen interest in understanding the intersection of state politics and social change, she worked at the legislature as the legislative aide to Representative Dominique Jackson for over 2 years. And in that role, she really gained a wealth of knowledge about the inner workings of the state legislature. So Melissa really brings a diverse background of skills and understanding to this work. She previously worked in healthcare, co-owned a media company, and spent many years at home with her 4 children. Melissa is a highly organized and logical thinker, and she enjoys getting to know legislators and clients alike. Melissa actually has a BA in political science and sociology from Metropolitan State University of Denver. And in her time away from the Capitol, she enjoys spending time with her husband and their 4 children at the lake and the mountains, or enjoying a relaxing weekend at home. And today, Melissa will talk with us about Legislation 101 and PPAN's policy goals for 2024. So as an organization, we're also looking at the implications of pesticide use and how their over and misuse threatens biodiversity and public health. It's really a complex situation, and large land management like agriculture, for example, isn't simple, and things are really moving at a fast pace due to a changing climate. So creating policies is one way to have a positive impact and promote outcomes that will better protect pollinators and human health. And we have a lot going on today, so just wanted to give you an overview of today's agenda. So first, Melissa will talk to us about Legislature 101 to really empower you with the knowledge to navigate this legislative session. And then from there, Bret will present about public health and pesticide use. And then finally, we'll chat with Melissa again about PPAN's policy goals for this year, which tie into both pesticide use and public and ecosystem health. As a reminder, please stay muted, leave your questions in the chat, and we will get to them at the end of the presentation, time permitting. We also encourage you to make a donation today so that PPAN can continue to host this free webinar series, and this donation will really support PPAN's education, advocacy, and habitat creation efforts in 2024. And a donation of any size really does make a difference, so thank you for your consideration. And I can put a link in the chat to make it easy for people. And with that, thank you all, and I will pass it over to Melissa.
Great, thank you so much for that introduction. I'll go ahead and get my slides pulled up. All right, can everybody see what we've got going on? All right, so just gonna work here through kind of what it means, what the legislative session looks like, what happens down at the Capitol on the day-to-day, and how a bill becomes a law. So we'll start with the Colorado General Assembly website. The website is full of all sorts of useful information. So we will cover a variety of those things here briefly in this little 101 session, but would encourage everyone to take note of this website. The website is leg.com. So the Colorado General Assembly website has lots of useful information. You can find all sorts of things there. It's ledge.colorado.gov, and I will show you in some of these following slides some information that you can find there. Is that better, Joyce? Okay. So the Colorado State Legislature is made up of 100 different elected officials. We have 65 who are in the Colorado State House of Representatives. They can each serve 4 terms. Those terms last for 2 years each, so for a total of 8 years. And then the Senate, the state's divided into 35 Senate districts. So we have 35 Colorado state senators, and they can serve 2 terms. And each of those terms are 4 years, so for a total of 8 years. Colorado went through some redistricting a few years ago, so we have some maps here that show how the state's broken down. They're on the left. One of the useful tools that is on the General Assembly website, and a really useful tool for the public, is being able to find your legislator so that you can communicate with them, you can find out what they're working on. So if you go to the Colorado General Assembly website, you're going to click on that main page. There's a spot that says Find My Legislator. Once you click on that, it takes you to that slide number 2 on the right. And you're going to click on Find My Legislator again, and it pulls up a map where you can search by address. You input your address, and it'll show you who your representative is and your senator is. This allows you to be able to contact them. You could get on mailing lists to find out if they have open houses that they're doing, town halls, things like that. You can also see what type of legislation that they're running and follow along through the legislative session. Cover quickly, the executive branch is headed by the governor. Right now we have Governor Jared Polis. He's a Democrat. He's currently in his 2nd term. He can serve 2 4-year terms. The executive branch covers all of the executive departments, all the state departments and divisions. Current breakdown of what the state legislature looks like by the House and the Senate. In the House, we currently have 46 Democrats, 19 Republicans. And in the Senate, we have 23 Democrats and 12 Republicans, and then a Democrat polis. The three chambers, both being controlled, is often referred to as. And then the perks of being in the Democrat majority. So perks for the Democratic Party here at the legislature are that
Melissa, I'm going to interrupt again. It seems that if you are facing more to the left of your screen, we can hear you better.
This way?
Yes.
Okay. Thank you. We'll get figured out. Of the majority, they get to decide what committee a bill gets to go to. They decide the majority on each committee. They determine who sits on the committee, the number of members on the committee, and then on the floor, which is where a lot of the votes happen, you need 18 votes to pass a bill in the Senate and 33 votes in the House. And if you'll remember correctly, in the Senate, there's 23 Democrats, and in the House, there's 46. We have a good majority there. For leadership, we'll just put this here really quickly. They in the House majority, there's a Speaker of the House who's currently Julie McCarthy. She represents the district out of the Central Mountain region. Majority Leader Monica Duran from Westminster. Assistant Majority Leader Jennifer Bacon from Denver. And then we have 2 members who sit on the Joint Budget Committee, Shannon Bird and Emily Sirota. And then the minority leadership, you may have seen in the news that the minority leader from the House stepped down from his position yesterday. And this morning they elected a new minority leader who was previously the assistant minority leader. So we expect some changes still there. And then in the Senate, instead of having a speaker, they have a president. So they have Steve Fenberg, who is from Boulder. Majority Leader Rodriguez, who's from Denver. James Coleman is the president pro tempore, also from Denver. Assistant Majority Leader Faith Winter, who's from Broomfield. And then on the Joint Budget Committee in the Senate, we have Rachel Zenzinger and Jeff Bridges. Senate minority leadership is Paul Lundeen, with the assistant being Bob Gardner, and on joint budget committee is Barb Meyer. Some dates, important dates. The state legislature runs for 120 days total every year. A little fact for you, the state legislature, the only thing they have to do constitutionally is pass a budget. Everything else that we do is extra. So this year, the state legislature convened on January 10, and then we call the last day of session sine die, and that is May 8th this year. So we have a lot of work to do in those 120 days. So there's different legislation that gets passed, or different, with 3 different things that the legislature does: bills, resolutions, and memorials. We're largely going to focus on bills right now. That is how laws get passed. Resolutions sometimes are more of a statement, and then memorials for folks who perhaps served in the legislature and have are being recognized for things they've done. And so in order to get to a bill, we work on policy, and that comes about in a variety of ways. It can come from stakeholders, members of the community, also called constituents. Sometimes a legislator has an idea that they've heard, maybe from a conference or somewhere they've been. Perhaps it's model legislation drafted from like a national org or something like that. So that is kind of where ideas come from for bills and laws that get passed. If you're going to work on bill creation, the first place you have to start is with a sponsor. And a sponsor is the person who is going to usher the bill through the process in the General Assembly. And they are the ones who have the authority to draft legislation. They work with, in Colorado, we have professional bill drafters. They are attorneys, experts on our complicated laws here in Colorado. And so the sponsor would go to a drafter with their idea. They get it written out on paper, and that's where the work starts. If you want to look at what's happening this session, bills that have been introduced, and how a bill is moving through the process, that can all be done on the General Assembly website too. Again, that's leg.colorado.gov. If you click on bills, a drop-down menu comes down and you click on all bills. And then if you move to the right there, number 2, this is the next screen that comes up. You can search by bill number. You can search by whether that bill started in the House or the Senate. You can filter by bills, resolutions, and memorials. You can search by the particular session or subject. And then once you find a bill that you're interested in, if you click on it, you can find a bit more information. You can read the bill. You can find out if that bill is going to cost the state any money. You can additionally see how legislators have voted on that bill, which is all useful information. Just quickly, I'm not going to run through all of these various steps, but a bill has to go through a lot of steps before it actually becomes law. It has to be introduced, and then every bill in Colorado that is introduced gets a committee, at least one committee hearing. And that's the place where public testimony is allowed. So members from the public come down to the Capitol, or they participate and give their testimony virtually. It's a great way to get engaged in the legislative process. There's a rundown of what the various committees look like. Committees are broken down by subject matter, and a bill, depending on what the content of that bill is, will get assigned to one of these committees to be heard. Again, this is the Colorado General Assembly website. You can follow along. It's exciting listening. If you would like to follow along a committee hearing, if you want to listen, I was last night. And you are always, it's always public, and you can always listen to the audio. The House floor and the Senate floor have a video feed with audio that you can watch, but committees are only audio. So if you click on the committee, pardon that. a bill is going to, you can click on that committee audio and actually listen to the committee. These are some ways that you can engage legislators, if you know who your legislator is, which is super important. You can follow along through the legislative process. A lot of them hold town halls. They put out emails about what they're doing, and you can email them. You can visit their office. So I highly encourage everyone to know who your legislator is. A lot of them have a presence on social media where they post regularly on Twitter, Instagram, Facebook. And then you can come to the city. It's particularly impactful when somebody comes and says, tell the legislator, you are my legislator, I'm your constituent. This kind of shows a rundown of how you can sign up on a particular bill, also available on the website. If you do the drop-down menu on committees, there's an option for public committee, and that's how you sign up to. So yes, so that is the General Assembly website. Can you hear me better now, Joyce? That's the General Assembly website, full of great information. And I am going to pass it off to Bret now, who has some really important information to share with us. I'm going to stop sharing my screen.
Thanks, Melissa. Let me pull up my slides here. Get that full screen for everybody. All right, how's that look? Good to go. All right. So my name, like Anna Gray said at the beginning, is Bret Turner. I've worked with Joyce and PPAN now, gosh, I think for 3-ish years. I started as a part of my master's program and my practicum and capstone. So what you're seeing today is my capstone presentation for my master in public health, which I just graduated in the spring. And I'll be looking at, or what I did look at was pesticide policy in Colorado compared to the rest of the state. So just to lay the background here, Colorado uses roughly 1% of the 900 million pounds of pesticides applied annually. So that equates to about 9 million. In Colorado, at least the most recent statistic I found from 2017, there were 19.78 reported pesticide exposures per 100,000 people. And you'll see reported is emphasized. We'll discuss why later. And then these exposures to pesticides and the negative health outcomes almost always disproportionately affect BIPOC and low-income communities, so are most vulnerable. So why we'll look at public policy when it comes to your health? Well, the Sycamore Institute, which is a public policy institute, says these are the 5 ways that public policy can impact your health. I'm going to be focusing on that middle one, the requirements and mandates to protect citizens, because that's the one that applies most to pesticide law. But those are the ways that policy can impact your health. And then it's a little blurry just because I sized it up. In public health, we love a theory and a model and a chart. So this is called the social and ecological model of health. This just tries to account for everything outside of your individual genetics and health choices that affects your health. So things like access to care, family support, social support systems, all the built environment, all those sorts of things. And you'll see that outer ring there, public policy can affect your health at the highest level. Just to lay the regulatory framework for pesticide law in Colorado, at the federal level, you have the Federal Insecticide, Fungicide, and Rodenticide Act. And then the EPA says that so long as a state has an approved implementation plan in place, they can regulate pesticides as they see fit. So at the state level in Colorado, you have the Pesticide Applicators Act, the PAA. Obviously, there are other regulations that affect, the sale and use of pesticides, but that's the primary one. And then in some states, the local government can regulate pesticide use in their communities as they see fit, but Colorado is not one of those states. pesticide regulation by local entities is preempted by the state of Colorado. There's the table of contents for the Pesticide Applicators Act. You'll notice you don't see the word health anywhere. I think the only time in the PAA it mentions health is the section where it says applying pesticides in a way that is harmful to human health is unlawful. It's pretty vague. The PAA undergoes a review from DORA every 11 years. It underwent that review in 2022. But just to give you an idea of how quickly industry moves compared to the regulatory process, when I made this presentation last spring, 461 new pesticide formulations had been registered with the EPA since the start of 2023. So a little bit quicker than the 11-year review process for the law. So the goal of this project was to just look at the gaps in Colorado's pesticide law that address public health, and then compare those regulations to those in other states to consider what we should do when we're legislating in the future when it comes to pesticide and public health exposures. So to do this, I used a framework. It's a policy analysis framework called Bardach's Eightfold Path. Bardach is just a professor, I believe, in California, who came up with this to guide people through policy analysis. So these are the steps we're going to go through. I will say step number 7, decide, I will not be including. I am not a legislator. I don't decide directly. I will not say at the end of this which policy I think should be implemented. I can give you my opinion on it later, but for the sake of this project, I was more focused on the tell your story part at the end. So just to reiterate that this pesticide exposures and health effects is really an equity and environmental justice issue. This map on the left here is pesticide application rates for 2019 in kilograms per square miles. You'll see those orange and red counties have much higher rates of application. And then on the right are 2 different measures of vulnerability in population. So you have the top map, the health and social factors score. The higher the score, the more vulnerable the populations in those counties based on those measurements. So those would be your red and orange counties again. Health and social factors would be things like access to healthcare, age and other demographic factors of the population, things like that. And then same with the bottom right map, that's a pollution and climate burden score. So again, higher the score, more vulnerable the population, the red counties and orange counties. That would be how vulnerable are those populations to the effects of climate change and the effects of pollution. And I put these maps up here to show that there is crossover. So you are having high pesticide application rates in counties where there are already highly vulnerable populations. So just to start, please don't snap your neck trying to read these. They're on the next slide. In looking at alternatives to what we have in Colorado, I went through the laws that govern pesticide use in every state, constitutional, statutory, and administrative. I did not look at case law, I simply just did not have the time. But I pulled out provisions related to the protection of public health in every state's law and put them in a chart like this. And then on this next slide, again, this is a wall of text, which is terrible PowerPoint practice, and I apologize, but I just wanted to show how many legal provisions there were within state laws that protect public health. So for example, the white text is the specific protection. So the one in the dead center, for example, 1 or more application methods specifically banned. The black text is an example of how that would read in a state's law. So that would be like if the state said, bulk aerial spraying of pesticides is forbidden. So that's an example. And again, I'm not going to go through all these. I'm happy to share this presentation after, but these are just the types of things you see within the law. Again, another public health chart. We love our charts. This is called the hierarchy of controls. You use this when you're looking at a harmful exposure. So for example, pesticide exposure, you can categorize the different ways of protecting a person's health into these categories. The top of the pyramid being the most effective ways to control for that hazard, and the bottom being the least. So at the top, you have eliminating the hazard completely. So that would be like getting rid of chemical pesticides altogether and using something else. The bottom, least effective, is PPE, which we all know what that is from COVID. That's the least effective. It's your last resort. So that would be like wearing a chemical respirator when you're spraying pesticides. And so I took all our legal provisions and I put them into those categories. And if you'll notice, about 75% of those provisions fall into the administrative controls category, which is second to last in effectiveness. That would be just changing the behavior of people in order to make pesticide applications safer. Just to briefly go into a global lens real quick, really globally, there are the same issues with pesticide exposures as there are in the United States. The big difference is other countries are much more inclined to reassess the use of pesticides and to limit their sales. And you can see that on this next slide. Again, I pulled this last year, but these are pesticide bans by country. You can see the EU and the UK at the top there with 269. The US is down there with voluntary withdrawal of registration at just 81. So we're a little bit behind our friends in Europe. So once I pulled out all those different types of protections from the laws, I wanted to evaluate them in these different criteria. So you can think of this as a score out of 100. So I would take something like PPE requirements, and I would rate that in safety, equity, legal feasibility, and so on. So 20 points for safety, 20 points for equity, et cetera, et cetera. I weighted safety and equity highest because that's what I was looking at in this project. Really, you could redo this with different weights, however you'd like to do it. And in those ratings, I'm trying to be as objective as possible with my professional opinion. So these are the guiding questions. So for example, when I'm rating an exposure control in equity, I ask myself, does the policy distribute its burdens and benefits equitably? Yes, no, or kind of. And so that's how I went through each provision and asked these questions to rate things. We're going to get a little confusing with this slide, but I'll explain. So I went through each legal protection, which are those in the first column, and I rated them in each evaluative criteria there on the top. And I gave them a score of low, meaning it doesn't score well in that category at all, medium, meaning it's okay, and high, meaning it's great in that category. So for example, does pesticide registration prevent exposures, aka is it safe? Well, it doesn't do a whole lot to directly prevent exposures. So that rates low in safety. So of the 20 points of the pie for safety, pesticide registration gets 10 points. And I did that for every legal provision. And I realize this sounds like something I invented myself, this scoring scheme. This is actually something that's used in the evaluation process when you're looking at these things. But again, you could redo this with your own weights, your own opinions. I did try to be as objective as possible. With that, I gave each state a regulatory score based on both the number of provisions in its laws and the effectiveness of those provisions based on my evaluation. And I plotted the state's regulatory score out of 100 against its pesticide exposure rate per 100,000 people across 9 years. And this is the chart that I got. There is Colorado right there. Now, if you notice that trend line in the middle, it appears that the higher the state's regulatory score, the lower its pesticide exposure rate per 100,000 people. Now, let me disclaim that. It's just a correlation, right? In science, you can't officially say that tighter regulations leads to lower pesticide exposures without all kinds of studies. You can't just slap that trend line on any old data. There are statistical rules about doing that. But I'm putting this up here to show that there is a relationship worth investigating, and that when it comes to legislating about these pesticides, this is the rigor at which we should be thinking about these things. So there are obvious limitations, right? The data is not perfect. It doesn't account for inert ingredients and mixtures. The exposure data is highly underreported, right? That's why that word reported was underlined at the beginning. I'm a human. I could have messed up. I'm sure the regulations have changed somewhere since I did this project. But really, why bother doing this at all? Well, in public health, the first reason is we have something called the precautionary principle. And that says when you don't know something about a potential health exposure, you treat it as harmful until it can be reasonably proven otherwise. Now, pesticides go through a testing process, but remember I said since the beginning of 2023 through spring of 2023, there were almost 500 new formulations of pesticides. So industry is moving quickly, and until we have time to thoroughly study every single chemical ingredient, you should treat it as harmful. The next reason is this kind of thinking and this kind of study provides insight. And this is one of my favorite quotes from a statistician. All models are wrong, some are useful. No study is ever going to fully capture the complexity of real life, but it's still useful to do. The knowledge is still valuable. Then the last reason is we have an opportunity. This is yet another START theory here, Kingdom's multiple streams model. It just says when you have a problem, aka in our case, pesticide exposures, you have a policy that could fix that problem, and the political climate is amenable to passing that policy. When all those things line up, you have a chance to change policy. That's called your policy window. My personal recommendations for the future, we have to fill our knowledge gap about pesticide exposures and health, better tracking of application. We need more protections up here in this area on the hierarchy of controls, thinking about elimination and substitution rather than down here in these less effective methods. And then equity and environmental justice should always be centered. This is fully an EJ issue. And when we address this issue through the lens of our most vulnerable communities, it's good for all of us. Like that quote, a rising tide lifts all boats. We're all going to benefit. And then PPAN is working on implementing a lot of these solutions. So they're filling knowledge gaps with things like the native pollinating insect health study. Pollinator health is directly tied to public health. They're improving exposure prevention by advocating for stronger pesticide regulations and teaching people sustainable land management. And then they're centering equity and environmental justice. So working with coalitions in communities across Colorado and always considering equity. And then these are just some people who helped out with this project. And that is all I've got. I'll stop sharing now. And I'll pass it back to Melissa.
Thanks, Bret, for all of that insightful information. Can everybody see the screen there? All right, awesome, thanks. So what can we do? Bret shared on that last slide that one of the things that PPAN is doing is advocating for stronger pesticide regulation. And what does that look like? Well, for PPAN for the last few years, that has looked like trying to get local control or local governments the ability to have to regulate pesticides on some level. So what is local control? Bret touched on this briefly, but what that is that currently right now, the state has preemption of pesticides. So that means that local governments cannot have pesticide regulations that are more strict than the state. So the state says what is allowed, how it can be used, and a local government cannot regulate it in any way. They cannot have regulations about notification. They can't have regulations on water quality. They can't have regulations that say when and where you can spray. That entirely lies at the state level. And here in Colorado, that regulation lives at the Department of Agriculture. And the Department of Agriculture, it should be noted that there's nobody at that department who specializes in human health. It's entirely looked at through the lens of agriculture. If local governments had some authority to regulate pesticides, they could pass ordinances around pesticide use in their communities. So why local control? Well, every city and community in Colorado is unique. There's unique ecosystems, there's unique vulnerabilities for people who live there, and there's unique values. There's certainly communities here in Colorado whose values align with lessening the chemical burden on their communities. And the other thing local control does is it allows for some targeted, limited, and narrow regulation to address specific issues. And it would allow the local government to enforce those regulations at the local level. Right now, pesticide regulations, as I mentioned on the last slide, are all at the Department of Agriculture, and the Department of Agriculture is the only entity allowed to enforce those regulations. So for example, if in your community you see something that is perhaps illegal for pesticide application, locally within your community, you have no recourse and no ability to handle that. You do have to call the Department of Ag. And sometimes what we see in needing to call the Department of Ag is that, you know, if somebody sprays something, by the time they can get there, the evidence of that is gone. It's been washed away, it's moved, no longer visible to somebody who may be enforcing. So what has PPAN done in this space? So back in 2020, I'm sure you all remember this year well, this was the first year that People in Pollinator Action Network had a bill that would partially restore local control of pesticides. And the bill was scheduled to be heard in the Senate about 2 weeks after COVID shut down the state capitol and shut down our country, quite frankly. And so that bill did not go any further. In 2021, a decision was made to take a pause in thinking about this issue because there was a lot of big things happening at the Capitol that year in response to COVID. And that year, PPAN ran a bill that produced a pollinator license plate that brings funds in that allows People in Pollinator to issue grants to people in the community who are working on biodiversity, ecosystems, and things like that. And so in 2022, PPAN came back to looking at local control again. So in 2022, PPAN came back to the state legislature with a broad bill that would have restored some local control, and it did a number of other provisions. One of them was in that broad bill was a study for the Department of Natural Resources to look at pollinator health across the state. Ultimately, what happened that year is that piece of the legislation moved on and ended up being hugely impactful. So the bill directed the Department of Natural Resources to conduct a study to look at across state agencies, how they coordinate, who's looking at pollinators, and the health of pollinators across the state. That report was just put out publicly at the beginning of this year, and it's full of lots of valuable information about next steps that the state can take and things for the state to think about. Last year, and in 2022, the other thing I'll note that in conversations around local control of pesticides, a lot of folks told us that we should be waiting to have the conversation about local control of pesticides until 2023, when that Pesticide Applicator Act that Bret talked about was up for renewal. Joyce, you want to jump in for a second?
Yes, so during the sunset of the Pesticide Applicators Act, there was talk about having an amendment to add this ability to have local control of pesticide use, but it was determined that it would be best to leave that aside from the Pesticide Applicators Act and have that conversation at a later date. And that really brings us to 2024, where we have been working with legislators to craft some legislation around this issue. Again, it would be a pretty simple and straightforward bill. You see here the legislators that are the key sponsors of this legislation.
Yeah, I can hop in back in now. I think I'm good for a second. So these legislators that we have listed here have been huge champs around pesticides and pollinator health. But how is this year different? What are we doing differently? You know, one of the big things we've run into is agriculture. Agriculture has been, pardon me, has been a steep hill to climb. And this bill has always gone before the Committee on Agriculture.
I'll jump in, Melissa, to say that we have asked that agriculture be exempted from this local control bill. So if a bill like this were to pass, it would not impact agriculture at all. Agricultural producers would still have the ability to operate as they do today. The community or county could not have any say over what they do. And as an organization, PPAN has committed to that exemption. We feel strongly that there's other ways to work with the agricultural community and that probably local control is not the best way to do that.
Since we're exempting agriculture in its entirety, we're really hoping to be given a fair chance for this bill to be heard as we are restoring some authority to local governments. And you know, the other thing that's different about this year that I'll point out is that we've had a number of years where we have had these conversations, and the conversations with folks, opposition has just continued. We've continued to have those conversations. We've continued to make some adjustments and continued to be open to conversations both with legislators and with opposing stakeholders on this. So we will continue to move forward on this. We do not yet have a bill that has been introduced, but we are very close to that. And certainly we hope that those of you on this call who are interested will engage in this space, and I will pass it off to Anna Gray, who can talk a little bit about how to engage.
Awesome. Thank you, Melissa. Let me do a quick share. All right. So first of all, thank you so much to Bret and Melissa for speaking today. I think we really learned a lot from each of you. And so now that you all have a broader understanding of pesticide policy and public well-being, in relation with PPAN's policy goals, we really encourage you to take action. You can do this by calling your state and local electeds, your state legislators about the local Control of Pesticide Use bill. We also have a fact sheet that you can sign on to. And then lastly, you know, donate to organizations that you think will help make a difference. I'll throw our donation link in there again. But we'll also be sending out an email in the next few days about how to follow through with these action steps. So with that, we can go into our Q&A section. Let's see. So kind of just a little housekeeping. I know Bret already shared his slides, but Melissa, people are wondering if slides will be available following the webinar and if you could share those. Looks like that's a yes, so we'll definitely get those to you all. And so another question that we have here is there a calendars committee to stop bills from going to the full House after passing the first committee?
Yeah, I see that question from Joel. So here in Colorado, there is no such committee. So every bill gets a committee hearing, and if the bill passes committee, it just moves on to the next step in the process. But if a bill dies in committee or is what we call postponed indefinitely, then that's it. That's the end of that bill, and it does not move any further during the session.
Thank you. The next one here, probably for Bret. So if pesticides are only evaluated every 11 years, Is there anything to evaluate in between? And did the 400 and some newly introduced pesticides get introduced by companies intentionally after the DORA evaluation?
So that 400 figure was a national number, so that would be 461 pesticide formula, so specific chemical formulations registered with the EPA. And as far as the evaluation every 11 years, Melissa can jump into, that's just the evaluation period for the Pesticide Applicators Act itself. All the safety regarding individual pesticide formulations is supposed to be built into the process of EPA approval. So a company introduces their product, registers it with the EPA, and the EPA says, have you done adequate safety testing? Let us see your data, et cetera, et cetera. So that's how the individual pesticides get evaluated. If that answers your question, hopefully.
Great. And in terms of the local control bill, people are wondering, what about the neonicotinoid bill from last year? Did that do anything?
Joyce, that may be a good one for you to jump in on.
I can jump in on that. The neonic bill, for those of you that don't know, has designated neonics, which there's a lot of scientific evidence of their impact to pollinators, as limited use pesticides. So it's a new category that the Department of Agriculture established. The idea was to limit access of people that don't have the training to use pesticides, access to that sort of chemical. So it has to be a licensed dealer that sells neonics now. So it will take some of that neonic use out of the hands of homeowners that may not have that training. However, it doesn't really get to the heart of the issue. We still have a lot of neonic use. So yes, we could have some stronger legislation around neonic use.
Great, thank you, Joyce. So we know that the local control bill is exempting agriculture, but what exactly is being addressed when it comes to pesticides with the local control bill? For instance, pesticide application on residential yards.
I can take that. So there's no specific parameters on what a community might like to do, other than it would have to be a more stringent regulation than we have at the state or federal level. And the way the system is set up is that there is a delegation of authority from the federal to the state to the local level. The only reason municipalities don't have that right now is because of this state level preemption. A community could make better decisions about how they might want to protect special resources or public health. A few examples of what a community might choose to do: they might choose to have greater notifications around the spraying of pesticides so that people are better informed about where and pesticides are being sprayed. They may choose to protect a special stream or public resource that is sensitive. Maybe there's something about it that has plants or animals that need to be protected. So it would need to be have some really good evidence to show that there's a need for that, and that community would then have the ability to make a new ordinance to put that protection in place.
Great, thank you. And then another question we have is what have the main arguments against local control been?
Yeah, that's Bret, did you want to do that? I see you.
Oh no, go ahead. You go ahead.
Yeah, maybe if you
I'll
have
add what I have.
Great. Yeah, I'll start. So a lot of what we hear is concerns about a patchwork of regulations across the state that make it difficult for folks to know what a particular community's regulations are. That's probably been the biggest argument we've heard against it. The other one is some concerns from agriculture, that despite that there is an agriculture exemption in the bill, that at some point somebody may run a bill to remove that agriculture exemption. Those are the two, I think those are the two biggest arguments I hear regularly. Bret, do you have something to add, or Joyce, something to add there?
Yeah, I'll just add that we hear that maybe communities aren't able to make good decisions. And we would say that we think communities are going to reflect the values of the people who live there and do have a lot of expertise at that local level. The federal and state government can't move quickly enough to solve these problems. As Brett, just that one example of how many new formulations are in place. We're putting more pesticides into use, and we're not adding to the protections that we have. So this is a way to be more innovative at the local level. And you go ahead, Bret, and add to that.
I'll just say preemption comes up in public health all the time. I'm pretty passionate about local control. A good example is with the tobacco industry. The tobacco industry lobbied very hard to prevent local governments from being allowed to regulate tobacco. It comes up all the time. And yeah, it's always the patchwork argument, the argument that local governments don't have the expertise around these issues. There were some preemption issues that came up during COVID. So it's a tactic used, originally supposed to be used for levels of government to resolve disputes. Now, a lot of times, at least in public health, used as a tool to stifle opposition to industry, unfortunately.
Great. Thank you all. Joyce, did you have something to add?
Yeah, I'll just add one more point, and that would be that there are lots of industries, contractors, landscapers, building codes, all sorts of different regulations that need to be followed from from one town to the next. And so this would really be no different, that pesticide applicators would also potentially need to follow some of those types of rules.
Great. I think those are all the questions we have, unless anyone else wants to throw another one in the chat. I will put our donation link in the chat again. And just thank you all so much for being here today. It's really good to see each and every one of you, and we appreciate your support.
Thank you so much for coming, everybody.
Thank you. Bye-bye.